He may have had this in the past. He definitely had this as a child, but on the other side of the nail. He doesn't know if he had the other side of the nail removed, but looking at it, it does not look like it was removed in the past, but maybe they took a small piece out and you can't tell. Nevertheless, it's not hurting him, so we're only going to do the one side that's symptomatic for him. I tested it before I numbed him up to see if it was painful. So when I tested it, I just kind of pushed right here and he didn't have any pain. Definitely right here is so sensitive to the touch that we know that we have to take that out. So we're going to take that out. We're going to clean this up. I'm going to see if there's any pus in here. And right now when I push on it, I don't see anything, but there's definitely pus. Are you able to feel that?
No.
Okay. So now I'm going to put the tourniquet on him. And what we're doing is pushing all the blood out of the toe. Or not all of it, but a lot of it out of here. So it's as dry as possible. I personally like to use a drier field when I do the chemical because I can see it burning the nail matrices, and that's where the nail grows from. And when it burns the nail matrix, it makes a white color. And I'm able to see that white coloration when I do the procedure. And it tells me that the nail cells are gone forever and he won't get another ingrown nail. So I've exsanguinated, I push this back so I have a field that I can see. And now we're going to free up the nail. So we're going to do this side here. And what I do is I kind of look to see when this heals, this skin here, when it moves back over, how far do I want it? And I probably want it about right here, just for cosmetic reasons. So here in Florida where we live, a lot of people like to wear sandals, open-toed shoes. So we want it to look good. So we freed it up. And you're doing okay up there?
Yeah.
Okay, good. And we're going to now cut this piece of nail, and you can see where I've done it from. And I'm gonna go with this angle here, so it's a little bit further over medially. That's towards the medially is this way, towards the inside of the toe. And you can see that it's now cut. And we're gonna now remove the piece. And this is where it's the most exciting part of the whole procedure, where I slip this under, and you're gonna see how ingrown this actually is. When you look at it, you can see next to my hemostat, to the lateral side, which is this side of the nail, there's not much there, but when I pull this out and I'm going to twist it and pull it, you're going to see actually how much is in there. I'm slowly pulling it, and you can see there's a good amount in there, more than I have clamped with the hemostat. So you've got a good 6 millimeters in there, and I'm only clamping about 2 or 3. So it's about 3 times the amount that you can actually see on the outside of the toe. So now I'm going to pull this off, and you can see all the tissue coming with it as well. And that's all callus tissue that's formed from that nail digging in. And that's a pretty significant piece of nail. I'm gonna turn it this way so you can actually see the other side, what it looks like, the part that's growing in. And that's pretty significant. Now we're gonna clean the rest of the stuff out of the side here. And mainly the dead skin, we're gonna get out. You can see there is bleeding, but that's blood that's left over. We call that blood from venous congestion. That's where the veins are actually engorged from, where I wrap the tourniquet around the toe, and then anything that's left over in the area comes out. So I'm just kind of pulling this skin off. That's just some dead skin. And I'm going to see if there's anything left in here. And nothing. There's little pieces of dead skin around the edges. And that's not going to be of any significance here, any problems. So let's go ahead, and now we're going to burn the nail matrix. And burning the nail matrix is just putting sodium hydroxide, this chemical, into the area. You can see where I put the first stick in there, and right now I'm under the cuticle, and that's burning the nail matrix. No pain up there, correct?
Nope.
All right, that's great. So what this is doing is killing the nail cells, so it won't grow back again. We do about 10-second sticks, and we do 3 of them. If you look closely inside the nail, you can see what I was talking about. You can see the discoloration where it's a whitish color, and that's the actual chemical burn. And you can see what it's doing. See how it's lighter right there. If you look close, you can see right where I'm pointing. I'll point with the other end of the stick right there, where it's like a whiter color. That's how we know that we burned the cells, and they will die off, and they will not be able to produce any more nail. So that's the second stick. We'll do 1 more. And this is our last stick. And I'm doing a little bit further distally. Distally is this way. And I'm doing a little bit further distally just in case there's any more cells that are further up producing nail. And I make sure that I'm going as far laterally, which is that way, to make sure that nothing grows laterally either, so we don't get any nail spicules. If you don't kill every cell what happens is the nail spicula will form, which is just a little piece of nail. It's a little bit annoying because about every 3 to 6 months, you'll have a piece of nail sticking out, growing kind of sideways, and it will catch in your sock and in your shoe. So we make sure that that's gone too. Now we're going to flush it out. We're going to put some vinegar on there to flush the chemical out. So there's no more burning of the nail, and he doesn't have a violent reaction. I mean, the toe doesn't. I mean, violent in this case isn't really violent. It just gets real red if there's too much of the chemical, or if somebody reacts to the chemical, it gets real red. So we're going to wrap them up, and that's going to be the end of it. We've all seen the